Do patients with red hair require more anesthesia? Well, the short answer is yes, but it's nuanced. There is evidence that shows us that red hair, natural red hair, is commonly linked to variants in the MC1R gene. And studies have shown that people with variants in this gene may require slightly higher doses of certain anesthetics, especially anesthesia gases like sevoflurane and desflurane. There was one really well done study that found that red hair women require about 20% more desflurane for surgery to prevent movement. And so the reason why this happens is the MC1R gene does not just control hair color and skin pigment, but it also interacts with pain perception, endorphin and opioid pathways, central nervous system sensitivity. And this can translate into higher anesthetic requirements, altered pain perception, different response to opiates and local anesthetics, drugs that we commonly use for anesthesia. However, not all patients with red hair require more anesthesia. Hair color alone is not a dosing rule, and the effect is variable and it's modest. It's not very dramatic. IV medications don't really show a reliable, consistent difference between redheads and non-redheads. So we anesthesia doctors titrate to effect. We look at patient movement, physiological response, as opposed to hair color as we decide how much anesthesia gas and IV medications to give a patient for surgery. So to summarize, yes, redhead patients may require more anesthesia, but it's not true for everybody and the effect is minimal. So how do we know how much anesthesia to give patients? Well, that is the art of anesthesia. The short answer is that we don't give a fixed dose to everybody. We continuously titrate the anesthesia throughout the procedure based on the patient, the surgery, and real-time feedback that we get through continuous careful monitoring. So here's how it actually works in practice. We start with patient-specific factors. So before you even get to the operating room, we tailor your anesthesia plan based on your age. Kids and older adults usually need less anesthesia. We look at your weight, your body mass index, your body composition. We look at your medical history. Did you have heart disease, lung disease, kidney, liver disease? We look at your medication list, whether you take opiate medications, antidepressants, those all can affect your anesthetic requirement. We look at your substance use and abuse history. Patients who drink alcohol, who smoke cigarettes, who smoke marijuana, they have different anesthetic requirements. We look at genetics, including red hair, and we also look at your previous surgery and anesthesia history. So there is no one size fits all dose when it comes to anesthesia.